Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
a case scenario where pregnant woman, if a pregnant woman is on anti-epileptic drugs, if the pregnant woman is on anti-epileptic drugs, then what do we do? If the pregnant woman is on anti-epileptic drug, we will have to continue the drug, the same drug, and monitor and do therapeutic drug monitoring. Okay, then one more important thing is these anti-epileptic drugs will actually induce CYP, and thus they will interfere with vitamin K. Okay, so as a result, vitamin K deficiency can occur in newborn. So in order to prevent this vitamin K deficiency in newborn, we will have to give treatment with vitamin K of around 10 milligrams per day is given in the last month of pregnancy, last month of gestation as prophylaxis. Thank you for watching.
Thank you and thank you for watching.